Hello, welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you for joining us. There's some recent data that suggests that for every additional specialist that you see, you're going to stay about an additional day in the hospital. Here to talk about this phenomenon is G.T. LaBorde, CEO of IllumiCare. He's joining us to talk about hospital stays and how they relate to the number of specialists that you see. Welcome to the program, G.T. LaBorde. Thanks for taking the time.
Thank you.
Well, give our listeners a brief background about yourself. You're the CEO of IllumiCare, but are you involved in you're a medical practitioner? Are you a medical technologist?
Well, I've been in healthcare IT for about 20 years now, and my partner and co-founder in this business is a practicing physician. So we sort of bring both practitioners' perspective as well as technology perspective.
As CEO of IllumiCare, are you involved in patient outcomes? Are you involved in the overall patient stay in a hospital? What exactly are you involved in?
Yeah, our main line of business is special technologies and analysis that try to identify opportunities for individual providers really to make a better decision when they're taking care of patients in real time. So that might be that they happen to be on a course of care that is overly expensive, or it could be that they're on a course of care that may not be as effective as others. You might loosely think of it as clinical decision support, but it takes both a clinical view as well as a financial view now that patients have to carry so much of their own burden of paying for, hospital stays and other medical care with high deductibles and other co-pays and co-insurance and things.
It seems that treating patients for the zillions of maladies out there, there's a lot of trial and error. There's a lot of testing. There's a lot of try this, try that, try the other thing. Isn't that a necessary part of adequate care?
It's funny. We did prior analysis that showed just how much variation there is in the care that you receive by different providers or in different health systems. And this is not a new phenomenon. This is something that we've seen in healthcare for years, and analysis of Medicare data when you compare one geographic, region of the country versus another and what Medicare spends to treat the same condition, essentially, and you see vast differences in those things. And you would think as a patient, we sort of grew up with this notion of, certainly I did, that getting a second opinion is a good thing, right? Mm-hmm. The more providers whose sort of brains are wrapped around your case and who can offer input is a good thing. But in reality, it's sort of what this analysis found that I think we'll talk about today is kind of the reverse. It's sort of closer to the analogy of there can be too many cooks in the kitchen, basically. And healthcare is just one of those things where, more isn't always better. Every intervention that we do in healthcare carries some risk to the patient. Certainly it's more expensive for everybody involved, but, every medicine you take has potential side effects. And we all have stories of, our, elder relatives who wind up sick and who are on 20 different medicines. And next thing you know, they have some new complication that is a side effect of some medicine, and they get another medicine to treat the side effect. I mean, we've all sort of experienced this. Many of us have in our own lives. And so it's just one little microcosm of everything we do. Every procedure we do carries a risk. Every test we do has false positives and may lead us down this pathway of intervention that may not be necessary. Every drug we take may have side effects. So, healthcare is one of those things where you really want just enough to help get you better, but any more of that you don't want. So it isn't one of those things that more is better. It's one of those things where you want just enough and no more.
As CEO of IllumiCare, in your experience, is the shift in mindset a patient-driven shift, or is it a shift from the standpoint of practitioners' desire to give better care, or, as you stated early in our conversation, we as patients are footing more of the bill? What's the incubus of this shift in mind?
Yeah, it really needs kind of both. Part of what our healthcare system has experienced with rising deductibles and rising copays is that patients find themselves, really, many patients can't afford any kind of major medical event. They just don't have, they can't meet an $8,000 deductible, for example, as some high deductible plans have now. So part of the driver, there's actually a bunch of research out there that suggests that people actually forego care or are afraid to go to the doctor because they simply can't afford it. They can't afford what might happen. So that's a terrible place for us to be. But our focus at IllumiCare, we work with health systems. We gather data in real time on every medication order, every lab order, test and result, every radiology test order and result, the cost of all of those things. We most doctors can't even tell you what a medicine costs that they give in the hospital. And it's not really their fault. No one has ever told them. To be honest with you, many administrators can't answer that question. So one of the problems is just a lack of knowledge and awareness about just the financial burden of all of these things that we're doing has. And we also, calculate in real time and sort of present this data, not just on the financial risk and the cumulative financial impact, but also the cumulative clinical impact. So, for example, we tell doctors, hey, this lab test that, you may want to order, have just ordered, it costs $6.72 maybe. But by the way, this is the 42nd lab test you've done in this patient's admission. You've already extracted, 230 milliliters of blood from this patient in just all the phlebotomy blood draws to do all this lab testing. And you've now increased the patient's risk of anemia of requiring a blood transfusion by X amount. And when providers become aware of, and it's much like just walking into a restaurant and opening the menu and seeing, prices on the menu and seeing the calorie counts on the menu, you're like, wow, I had no idea that creme brulee was, 800 calories. Some of those things causes you to just be more judicious and more careful. And quite truthfully, efficient medicine is good medicine. It's better for patients physically. It's better for patients and, health systems financially. So that's kind of that's the analysis that we do. And as a part of that analysis, we started looking at, well, gosh, what happens if the more doctors that you see, the more doctors that write orders on you, whether even they're specialists or not, what is the effect of that? Does that have a positive effect on your length of stay and your outcomes, or does that have a negative effect? And that's kind of the analysis that we recently just generated and shared with the world.
Let's talk briefly about the competition between providers and facilities to retain patients, to have high ratings when it comes to overall patient outcome. How does that affect the number of labs that are going to be ordered, the number of specialists that are going to be seen within that facility or outside of it?
Yeah, unfortunately, there probably are a number of patients that feel like the more things done to them is just a sign of thoroughness and a sign of, we just naturally as patients, the reason why I think the answer to this really lies in providers and their understanding and their behavior, because they're the experts. They really know where the line should be drawn in terms of value to the patient, right? So a patient doesn't know, what's the incremental value of this test that you want to do? What's the incremental value of this, 18th drug you want me to take? And really, it's up to providers to sort of be the brake. I guess a microcosm of that is just think about how many patients go in with the sniffles and want an antibiotic, right? We as patients, many patients think, oh, if I take a drug, it's better than not taking a drug. Well, no, not really. That's an example of a circumstance where it actually leads to something really bad. So it's really up to providers to sort of use their clinical knowledge and help coach patients on really where the line of value should be drawn in healthcare.
Where can we go to a website where we can learn more about IllumiCare?
Yeah, we're at www.IllumiCare, which is ILLUMICARE.com.
GT, thank you so much for joining us here on Health Professional Radio.
Great to be here. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with GT LaBorde, CEO of IllumiCare. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. You can listen in and download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.